Hello everyone and welcome. This is our second of the Child Health Network of the NHS Executive series of what everyone in the NHS can do about children's ... And today we're really pleased to be talking about children's rights. We're going to be running these every 2 months. So if us to talk about or are important for us to address, then please just let any of the team know. And there'll also be the opportunity at the end to be able to give suggestions and things. Things that we've got coming up are Trauma Informed Wales and the voice of the of Looked After Children and what they want us all to know. So without further ado, a little bit of housekeeping just to talk about first. We're asking everyone to keep your cameras and your speakers microphones off, because we're going to be recording this and it'll be on our website, so it'll be open access for anyone. So basically have cameras off and your microphones off as well. If you'd like to ask questions, no problem at all. Just put them in the chat and then we will be able to put those to our guest speakers as we're going at the end, when we've got a section for that. As we did last time we ran the webinar, we're going to be using Mentimeter. That class, oh, I think can somebody turn the microphone off? Thank you. We're going to be using Mentimeter. So if you can all use your cameras to just click on the QRS code, which is there on the front page there. And that will then link you into, there's a quiz that we'll be doing, and there's also some questions and things. It just means that it's a bit more interactive and it makes it a little bit more fun for everybody. So I'd like to introduce two people who actually will need very little introduction, I think, to most of us in Wales. I'm just over the moon to be able to introduce both Rocio Cifuentes and also Dr. Rhian Croke. As I say, you probably don't need much of an introduction, but actually I'm going to tell you a little bit about both of them anyway, and then we'll just move on into a little bit of a quiz, and then I'll hand over to both of them, because you don't need to be hearing me, you need to be actually hearing from them. So Rocio is the Children's Commissioner for Wales. She's been in post since 2022. She was born in Chile, arriving in Wales as a 1-year-old with her parents as a political refugee from Chile. Prior to becoming the Commissioner, Rocio was the Chief Executive of EYST Wales, a Wales-wide organisation which supports ethnic minority children and young people, which she led and developed from its inception in 2005. She's also served as the Wales Committee member of the Equality and Human Rights Commission as chair of the Welsh Refugee Coalition, and she's also been a board member of the WCVA and WCW, lots of letters, CWYYS. She's previously worked for the Council of Ethnic Minority Voluntary Organisations, Swansea's Young Single Homelessness Project, Gower College and Swansea University, and is also the founder of the charity Mixed Up, supporting young people with disabilities. As no one will be surprised, she's won several awards for her work, including a Special Recognition Award from the Muslim Council of Wales, Social and Humanitarian Achievement Award, and the Ethnic Minority Welsh Women's Awards, and an Honorary Life Fellowship from the Institute of Welsh Affairs. And finally, in May 2022, she was awarded an MBE in the Queen's Birthday Honours in recognition of her services to the community in Wales. So no small feature managed to persuade you to come and talk for us for today. And equally impressive is Dr. Rhian Croke. She's the Children's Rights Strategic Litigation and Policy Advocacy Lead in the Children's Legal Centre in Wales. She leads on the promoting an environment that uses the law strategically to achieve positive change for children in Wales. She also carries out research and advisory work and has worked with public bodies in Wales, across the UK and Europe, advising them on embedding children's rights into practice. Rhian was previously the coordinator of the Wales UNCRC, which we'll be talking a lot about today, monitoring group, where she played a pivotal role in leading the children's rights monitoring and reporting to the UN Committee on the Rights of the Child, and also successfully promoted legislative and policy reform on children's rights in Wales. So without further ado, we'll move on today. I think that myself and the team of the Child Health Network, we all feel extremely passionately that we need to have a children's rights approach to all of health, and children's right to have an equal access to health. And that we all should be using these principles to apply in everything that we're doing every day. And that's the reason why we wanted Rocio and Rhian to come and talk today, so that we can really think about how we can embed these rights into everything that we do in the NHS in Wales. So just a quick icebreaker quiz for you all. I must get the answers up, otherwise I might give you all the wrong answers, although I have the experts here to correct me if I get them wrong. So yes, hopefully everybody's managed to get onto Mentimeter. So what age range is covered by the United Nations Conventions on the Right of the Child? So I'll give everybody a chance to vote. I think we haven't got that many people voted as yet, and I think we've got a few more quite a lot more on the call. So I'll just give you a moment.
Would you be able to put the QR code back up again just for a second, please?
Of course, and also we could drop it into the chat as well. Should we just go back a page, please, Rosie? And perhaps one of the team could also pop it in the chat, please. Thanks, Sam. Yeah, I can see we've got. There's nothing worse than being on a webinar when you can't access the QR code and everybody else is doing a quiz. So just waiting a moment more. Okay, so if we move on to the first slide now, and we've also put it in the chat as well. So if any of you haven't managed to catch it, you can get it from the chat. So. Just remember to keep your microphones off because we're recording this today. Okay, so the majority of people have said what age range is covered. The majority of you have said pre-birth to 18. Second has been 20 of you felt 0 to 18, and I can let you all know that you're correct. So the age that is covered is 0 to 18. So fantastic, that's great. Shall we move on to the next one? So which of these is not a right under the United Nations Convention on the Rights of the Child? So the right to relax and play, the right to be happy and loved, the right to join groups and meet friends, or the right to privacy? I think these are quite difficult questions, actually. But actually, if we did the quiz at the end, I think everybody would know all of the answers by then. So. Still getting a couple more people coming through. Okay. So we're almost split here. So we have B at 32 of you feel it's the right to be happy and loved is not a right under the United Nations Convention on the Rights of the Child. And 29 of you, almost the same amount, is the right to join groups and meet friends. And actually the correct answer is B, the right to be happy and loved. So all of the others are parts of the Convention on the Rights of the Child. Fantastic. So which country of the UK was the first to establish a Children's Commissioner? Great, I think that's most people. Yes, and I can say that the majority of you are right. It was indeed Wales, which was the first, which is fantastic for us as a country, isn't it? Yes, so we were the first, which is brilliant. So moving on, which is the only country in the world that has not ratified the United Nations Convention on the Rights of the Child? So we've got Egypt, Ecuador, Australia, or the USA. This is the last question now. Great. So, yes, and you're all right again. Yes, it is indeed. United States of America is the only country in the world which hasn't ratified the United Nations Convention on the Rights of the Child. And I don't think we'll get into a political debate today, but it's an interesting fact. So I'd like to now hand over to Rocio and Rhian, who will then talk us through the children's rights approach and what we can do in the NHS to really embed this into all of our practice. So thank you so much, and please keep your microphones and cameras off, everybody else. Thank you.
Thank you so much, Claire, and to the whole team at the NHS Exec Child Health Network for organising this important event. I'm really thrilled to be here. And of course, thank you to everyone who is on the call and giving up, an hour of your precious time to this topic. So I really like the title of the event, actually, what everyone in the NHS can do about children's rights. So I know that previous events have been really informative and impactful as well. So I'm really looking forward to the next 45 minutes now, and encourage you to, while you're listening, think about any questions that you would like to ask myself or Rhian at the end of the session, because I think that discussion part can be really, really, for me, that's often one of the most interesting and important parts of seminars like this. So just to go, I've had a fantastic introduction from Claire already, so thank you very much, Claire, for that. But could we go to the next slide, please, Rosie? Yes, it's already been said, but I've been in the role for 3 years now, and it's a 7-year tenure term that I have, so nearly halfway. And I am the 4th Children's Commissioner that has served in Wales, with Wales having been the very first country in the UK to establish the office. I work with a team of 22 other people who we are all based, well, all but one actually, based in an office in Port Talbot. We have one North Wales based member of staff, but we do cover the whole of Wales, and that's a very important aspect of our role. So coming into the role, I was very, one of the most important things that I wanted to do was to be really clear about what the office is for and what its purpose is. So if we could go to the next slide, please, Rosie. These 4 purposes are how I have defined and described the office and what we are here for. So firstly, being here for all children is a fundamental part of our purpose. And that means that with my team, particularly with my engagement team, it's very important that we reach out and hear from the diversity and the range of children and young people who live in Wales. My team go out and do lots of visits in person, to schools, youth clubs, but also to young people in hospitals or mental health settings. And I often go on those visits myself. And what we hear on those visits are really, really important messages that we bring back to inform our wider policy and influencing work. So it's a really, really fundamental part of what we do. And, a key message is, that being here for all children in Wales. Secondly, it's a really fundamental part of our role and purpose that we are here to help to realise children's rights, not just to talk about them, but to help them be something that children and young people can experience in their real lives. And a core part of how we deliver that as an office is through my advice and assistance service, which is available to any child or young person or any adult who is concerned about a child or young person. And we offer a Monday to Friday free and confidential telephone-based bilingual helpline, which I would encourage you all to take a look at, and just for you to be aware of should you ever need to refer any child, young person, family or professional to that. And my colleague Kieran has just put a link in the chat to that. It is an important way of helping individual children and young people access their rights, but it also enables us to identify patterns and themes which we can use in our strategic work to feed back to governments or other public bodies about what needs to change. Thirdly, an important role of my office is to be a truth teller, and by that I mean speaking truth to power, using what I've heard from children and young people to communicate directly to decision makers, to those in positions of power. And often this can include, a range of issues, but it could be raising issues about, issues affecting particular young people with specific health conditions. Recently, I've been talking a lot about the debate around mobile phone use in schools. And within that, I've been highlighting the important function that mobile phone devices often play in helping diabetic young people measure and keep track of their insulin, for example. But my comms team do a fantastic job of, really pushing out those core messages and making sure that we are reaching as wide an audience as possible. And then fourthly, the role of my office in being a challenger, being a thorn in the side of decision makers and people in positions of power in public bodies in particular. So I have a fantastic policy team, of which Kieran, who's on the call, is part of. And we use the evidence that we gather from hearing directly from children and young people, as well as the evidence from our advice service, to inform our policy positions and our calls, and to challenge and remind government and other bodies of their duties and commitments to children's rights. So I could go on more further, but I will leave it there. So hopefully, just to be clear for you all what my office is here for, and please do use the links in the chat to find out more. Next slide, please. Thank you. So just the aims of today. Rhian is, a fantastic, very experienced academic and professional in this space, who will be introducing you to the UNCRC and running through the children's rights landscape here in Wales from a legislative perspective. And then following that, I will be talking more about how a children's rights approach that my office has been developing over many years can support you in your practical work, and what, to come back to the title of today really, and what everyone in the NHS can actually do about children's rights. So I hope you get a lot out of today, and I'm now going to hand over to Rhian. Diolch yn fawr.
Hello everyone, and thank you so much, Rocio, for the introduction, and also Claire so much for inviting me to speak today. So as Claire introduced, I'm the Children's Rights Strategic Litigation and Policy Advocacy Lead for Children's Legal Centre Wales, promoting an environment of using the law to achieve positive change for children in Wales. And I've been a passionate advocate for children's rights for many years, working alongside the Children's Commissioner's Office, promoting the importance of embedding a children's rights approach into the work of public bodies. So it's really fantastic to be here today, communicating about children's rights in partnership with our wonderful Children's Commissioner. And as Rocio introduced, I'm first going to give us a flavour of children's rights and the United Nations Convention on the Rights of the Child, and also what this means in Wales. And then Rocio will help us to think more about what this means in practice. Next slide, please. So the United Nations Convention on the Rights of the Child includes 41 fundamental rights for children under the age of 18, known as articles, many of which are relevant to addressing child health. It's the most widely ratified and important legal document for children globally. The UNCRC brings all human rights, civil, political and economic, social and cultural rights into one comprehensive document. Together, these articles aim to support and ensure each and every child's rights are respected, protected and fulfilled. There's no international court that can try violations against the UNCRC, but since 1991, a global committee of 18 experts have been monitoring the implementation of the UNCRC in countries that have ratified it. The committee holds regular sessions to review governments' progress made in fulfilling their obligations under the UNCRC and issues what are called concluding observations directly to governments, and also issues advice and recommendations in what are called general comments to all governments on how they should be complying with the UNCRC. Next slide, please. The UNCRC recognises that children are different adults. That is, they are smaller and younger human beings. And as is stated in the UNCRC, the child, by reason of his physical and mental immaturity, needs special safeguards and care. It acknowledges children are more vulnerable to abuse and exploitation, and dependent on their age or developmental stage, children are entirely or mostly dependent on adults, with their best interests not always considered. It recognises that children are often voiceless, not visible or ignored in the day-to-day decisions that affect them. Next slide, please. Thank you. Prior to the UNCRC, children were less visible in the human rights system. Although many of their human rights were included in the other international human rights instruments, states argued that there was a need for one comprehensive document that was binding in international law. The international framework of the UNCRC has made children more visible. In many countries, including in Wales, it has succeeded in raising children's issues up the political agenda, entitling them to be active citizens in national and local democracy. It has challenged many governments to invest in children so they can access, for example, the healthcare, the nutrition, the education they need to survive and develop. And it has succeeded in promoting the development of stronger frameworks to protect children from violence and exploitation, and also ensuring there are frameworks to listen to children and take their views into account. Next slide, please. Thank you. So in the short time that I have available today, I'll give you a brief overview to some of the most significant UNCRC articles in relation to child health, but I do recommend you read the convention in its entirety, as all the articles are indivisible, interrelated, and also to consider how the articles can be applied to your work. So the UNCRC, by seeing children as rights holders, is a groundbreaking legal document because it respects the inherent dignity of the child, acknowledges children's agency, and that a child's voice must be heard and acted upon in all decisions that affect them. So, for example, according to Article 12 of the UNCRC, children's views should be taken into account and given due weight in clinical decision-making. The child must be presumed capable of forming their own views, and it should be recognised that they have the right to express them. The UNCRC takes a life course approach and affirms the importance of the family to children, and in accordance with Article 5 of the UNCRC, recognises that children's capacities develop and evolve with age and maturity, and independent decision-making in the healthcare context will increase depending on the child's developmental stage. Article 13 also makes clear that children need access to appropriate information in a format that they understand so they can best engage with services. The UN Committee on the Rights of the Child asserts that children's views should also be taken into account in the design, delivery, monitoring and evaluation of services. Children should be able to inform what services are needed, what are the barriers to access, what will make good quality services for children, and always be given feedback on what has actually happened and changed. They also assert that children must be given knowledge to understand that if their rights are being breached and be able to complain and to have access to child-friendly complaints mechanisms. As I mentioned earlier, UNCRC rights are indivisible and interrelated. For example, the UNCRC both safeguards children's rights to be protected, Article 19, but also recognises children's right to be heard in all matters that affect them, acknowledging that if a child knows how to assert their right to be heard, they will be better equipped to speak out and claim their human right not to be abused. The UNCRC sets out the minimum standards of provision that all children are entitled to, from human rights such as Article 28, right to an education, Article 27, the right to an adequate standard of living, to Article 31, the right to play, recreation and leisure. These rights are all relevant when accessing or using healthcare, as well as contribute to children's overall health, well-being and development and what is in a child's best interest. The best interest of the child, Article 3, must always be a primary consideration in all decisions and actions, including individual clinical decision-making, and more broadly when developing or proofing health policies or ensuring appropriate standards of care for all children. Also, in accordance with Article 4 of the UNCRC, when budgets are planned for health services delivery, the proportion of expenditure on children must be made transparent and spend on children should be to the maximum extent of available resources. According to Article 6, every child has the right to life and to survive and develop to their maximum potential. Survival and development is not just about preparing a child for adulthood, it's about the child's development in the here and now. And the UNCRC recognises that children go through a rapid process of development and must be supported and their rights fulfilled at every stage. Interrelated to this, Article 2 places an obligation on all governments to comply with the UNCRC rights without discrimination on any grounds. It strongly emphasises that a child's right to survive and develop should not be undermined due to reasons of discrimination or the status of the child. And this is complemented by Article 24, the right of the child to the enjoyment of the highest attainable standard of health and health services. The UN Committee on the Rights of the Child asserts that all health services must be delivered in a timely and appropriate manner, ranging from preventative, rehabilitative, palliative, health promotion and curative services. Article 24 imposes a strong duty of action on all governments to ensure that health services are available and accessible to all children, with special attention to underserved areas and disadvantaged populations, for example, disabled children, care experienced children, children from ethnic minority groups, children who are seeking asylum. The UN Committee on the Rights of the Child states there should be functioning children's health facilities, goods, services and programmes in sufficient quantity available and accessible to all children without discrimination, that health services must be respectful of medical ethics, sensitive to age and gender, culturally acceptable, and goods, services, essential medicines must also be scientifically and medically appropriate, of good quality, grounded in robust paediatric research. It's also important to note that the right to health includes not only the right to health services, but to the wide range of factors that help children to achieve the highest attainable standard of health. This means that the wider social determinants of health must be addressed. That is, the conditions in which children are born, grow and develop, such as safe water, sanitation, food, housing, and ensuring access to health-related information and education. The UN Committee on the Rights of the Child draws our attention to the fact that health inequalities signify the non-realisation of human rights, and no child should face discrimination on any grounds in accessing their right to health. It also makes clear that the right to health is not just an aspiration, but is a human rights standard to be enforced by governments. So this is a rapid overview to the UNCRC, but I do encourage you to read the entire document, and I believe that one of my colleagues has put it in the chat. Thank you. Next slide, please. So if we turn to what is happening in Wales in relation to children's rights, as far back as 2001, Lord Carlisle issued a strong recommendation in his review of the NHS in Wales, that all staff having access to children should be trained to a full understanding of children's rights and an appropriate level of awareness of the needs of children, and that they should be required by their employers as a matter of specific contractual obligation to respect and apply those rights rigorously. So during this session today, it'd be helpful if as NHS staff member, you can reflect on your knowledge of children's rights and how it is applied in your day-to-day work. Next slide, please. Thank you. It's important to acknowledge that the political commitment of early devolved administrations, the UNCRC, certainly emphasised the importance of children's rights. The National Assembly for Wales enacted the first legislative reference to the UNCRC in the UK when the Children's Commission for Wales, established in 2001, was to have regard to the UNCRC in exercising their functions. In 2004, the National Assembly for Wales determined that the UNCRC would be the overarching set of principles for all devolved policies on children. And Wales is also quick to establish mechanisms to support children's participation in decision-making. From the onset of devolution, Wales certainly pursued an agenda that is supportive of children's rights. Next slide, please. Thank you. Of great significance to children's rights was when the UNCRC was indirectly incorporated into Welsh law via the Rights of Children and Persons Wales measure in 2011, requiring Welsh Government ministers to give due regard to the UNCRC when exercising any functions such as policy making, developing legislation and budgetary decisions. The due regard duty means that proper consideration must be given to all UNCRC articles, including those impacting on child health. So, for example, the Minister for Health and Social Services, as a duty bearer responsible for setting policy, overseeing performance and managing the finances of the NHS, should be ensuring proper consideration is given to the UNCRC. Key provisions of the rights measure include Welsh ministers must create and publish a scheme outlining how they ensure compliance with the duty and report every 2.5 years on progress. They must consider recommendations of the UN Committee on the Rights of the Child and undertake children's rights impact assessments to assess the impact of policy, legislative and budgetary proposals on children's rights. Failure to comply with the due regard duty could result in a judicial review. Alternatively, public accountability can be pursued through policy advocacy complaints or raising issues with Senedd members and Senedd committees. Next slide, please. Thank you. It's also important to acknowledge that there's been continued legislative commitments to children's rights in Wales. The due regard duty to the UNCRC also applies to certain public authorities in social care, health and education, as extended by the Social Services and Wellbeing Act 2014 and the Additional Learning Needs and Education Tribunal Wales Act 2018. Welsh legislation has also placed a duty on governing bodies and head teachers to promote knowledge and understanding of the UNCRC and indeed the UN Convention on the Rights of Disabled Persons in the new curriculum for Wales. Other pieces of legislation signal ongoing commitment to children's rights. For example, 16 and 17-year-olds have been given the right to vote in Senedd elections, and it's also so welcome that the Welsh legislation has removed the defence of reasonable punishment. These wins are to be celebrated, but for consistency and coherence and to support robust accountability for children, we would like to see similar legislation that has recently been introduced in Scotland that has directly incorporated the UNCRC into law, which means that all public bodies, including the NHS, must act compatibly with all rights in the UNCRC, and courts can provide a remedy in cases where a child, for example, is deprived of the right to access health services. Next slide, please. Thank you. As noted in the previous slide, the Welsh Government must take into consideration the recommendations of the UN Committee on the Rights of the Child. The UN Committee on the Rights of the Child monitors the implementation of the UNCRC in the UK, providing concluding observations every 5 years. The Welsh Government must take these into consideration. Child health has been a consistent concern since the UNCRC was ratified in 1992. The almost 200 recommendations from the UN Committee in 2023 demonstrates that the scale of non-compliance on children's rights across the UK is still deeply concerning and that duty bearers must do more to implement and embed children's rights. The committee's June 2023 report again highlights child health as a continuing concern and offers several key recommendations. For example, to directly incorporate the UNCRC into law, to ensure the quality of child-sensitive and age-appropriate paediatric and specialist healthcare services, and that children's views are included in their development and implementation, to implement strategies to address health inequalities, to reduce the large numbers of children living with obesity and poverty, and urgently address food insecurity and homelessness, to strengthen measures to address the underlying causes of poor mental health, eating disorders and other self-harming behaviours among children, and invest in preventive measures to address long waiting times for children with mental health issues, neurodivergent children, transgender and questioning children, and paediatric services more broadly, to ensure comprehensive age-appropriate and evidence-based education on sexual health and relationships, to ensure information to prevent substance misuse and accessible community-based drug dependent services, to address the large number of children living in areas of unsafe levels of air pollution. There are many recommendations in the UN's report. I've just touched on some of them, but all of these need to be taken into consideration by all those people working to address child health rights. So although we have, next slide please, thank you. So although we have embraced the UNCRC in Wales, we are still seeing a policy to implementation gap. We need everyone at all levels of government, all public bodies, including the NHS, policymakers and practitioners at all levels, embracing the bold vision of the UN Committee on the Rights of the Child, a bold vision that translates children's rights into reality, sees children as human rights holders, making children visible and not an afterthought, rooted in the UNCRC and therefore an internationally agreed and enforceable set of rights. A vision that's not just about charity or welfare, but about recognising that children are entitled to their human rights. A vision that seeks to address the root causes of children's rights violations with a strong focus on preventing and tackling inequalities. One that places accountability on public bodies to uphold the rights of all children with child rights compliant services, and acknowledges that children are experts on their own lives and should be empowered to participate in all decisions that affect them and claim their human rights. So Rocio will now move on to introduce the right way, a principled and practical framework that has been adopted by many public bodies in Wales and helpfully sets out what everyone can practically do to utilise this approach to translate children's rights into reality. Thank you very much.
Thank you so much. Diolch yn fawr, Rhian. Very comprehensive overview. So yes, and you've very helpfully made the link there between that legislative basis and the implementation gap, as it's politely put, really, in terms of how much further we still need to go to actually implement this approach. Apologies for the barking in the background. So my office has worked over many years to develop this approach, but I have to say with very expert and excellent support and advice from Rhian and the team at the Swansea University Observatory on the Human Rights of Children and Young People. So, you know, they have played a big part in helping us to deliver this approach. And there are many resources that we have developed over the years. There's a link in the slides, but my colleague Kieran will be putting links in as I'm speaking. But essentially, it's all about helping organisations to think about a practical way in which they could, actually implement a children's rights approach in their work. Next slide, please. So there are 5 key principles that we propose should form the basis of any children's rights approach. And we've called the children's rights approach that we've developed the right way. So if you ever see reference to the right way, there are many documents around. It is, the name that we have given to this children's rights approach. So the 5 principles are 5 kind of key things that you need to think about if, to turn the vision and the longer version of the UNCRC into a reality. First of all, to think about how you could embed the UNCRC in your services, and that is, I'll go into each of these in more detail in the coming slides, but just briefly, it's about how you could embed those principles into your service planning and delivery. Secondly, the principle of equality and non-discrimination is about what you can do to really make sure that no child is discriminated or suffers from less opportunity than other children in your services. Thirdly, about empowering children, making sure that your services are doing everything they can to enhance their capabilities, to take advantage of their rights, to have the information that they need so that they can understand and demand and apply their children's rights. Fourthly, the principle of participation, which is all about the importance of listening to children and taking their views into account in a meaningful way. And the fifth one is the principle of accountability. And it is a really important one, which is all about closing that feedback loop and making sure that you are informing children of all of the other steps that you may have taken through the other principles, and feeding that back effectively so that they are then empowered to hold you as an organisation to account. Next slide, please. So the principle of embedding, this one is about making sure that children's human rights are embedded as far as possible within your services. We have seen really good examples of children's rights being embedded in health boards. For example, Cardiff and Vale Health Board have a dedicated children and young persons board, as do several other health boards. Things that you could consider and think about include thinking about whether your strategic plans directly reference the UNCRC. You could consider the extent of knowledge of children's rights amongst your leaders and staff. You could look at what training and resources are available to support this knowledge and understanding. And as I've mentioned, we have a wealth of those. And you could also consider who within your organisations is actually responsible. Are there specific individuals or teams who are already or could or should be leading on children's rights issues? There are some really good examples of children's charters in some health boards, Swansea Bay, Powys, Cardiff and Vale. There's also good work that's been undertaken by the Welsh Ambulance Services Trust to promote a children's rights approach. And these are just some examples that I'm giving. There are many others that you probably are aware of. Next slide, please. The principle of equality and non-discrimination, it should be self-evident what it's about, but it's important to say that this is about thinking about equality and non-discrimination in quite a detailed way. It's encouraging consideration of potential inequality that children as a whole face. Are children having a lesser service or a lower quality service or a less accessible service than adults? Is there discrimination or inequality between the services that children of different ages can access? For example, is the service for babies and infants different to the service for older teenagers, for example? Are there specific needs that some groups of children may have? For example, we know that amongst Black and minority ethnic children and refugee and asylum seeking children, those groups are often, unfortunately, still acting as translators for their own parents in health appointments because there isn't always easily accessible translation available for people who don't speak English or Welsh as a first language in health appointments. We also know that there are specific barriers faced by traveller communities or home educated children in accessing certain health services. So how effectively are you considering those inequalities as an organisation? How much understanding is there amongst your staff groups about the Equality Act and about the diverse groups who live in your health board area, for example? Do you have the right data to underpin your decision making in this space? Have you got information available in different languages to meet different communication needs, for example? So there are lots of good practice examples. We know that the Aneurin Bevan iceberg model is a really useful model, and also the Nest Neath framework has been very effective in helping to improve joint work in between services for children in terms of mental health and well-being. Next slide, please. So the third principle is about empowering children, and this is about how you think about where the opportunities are to empower children, to give them the information that they need to understand their rights, but also to understand what they should do if they're not experiencing their rights in any of your services. Are there easily available information about your complaints systems, for example? Do you have a system by which children and young people can hold you as service providers to account? We've heard of really good examples. We're aware of Swansea Bay having worked with children and young people to co-produce a website. We also know of really good examples of children being invited to be part of interview panels to recruit practitioners. And these are really both excellent examples of empowering children and young people that we would really encourage you to think about. So on participation, this is about listening to children and really meaningfully listening to their views and meaningfully taking those into account. So unfortunately, we often see examples of participation which can I think there is a risk that they can be quite tokenistic if we don't go from beyond listening to actually taking action based on what children and young people are telling us. So this is a wider challenge that I often make to service providers. But we have got, again, really good examples. Cardiff and Vale listened to children and invited them to give their views when they were developing their new CAMS department, and children and young people were invited to choose the colour scheme and the furniture of a new room that was designed and is now available. And also Betsy Cadwaladr ran, I think are still running, a really good project which they call their 100 Stories project, where they invited children and young people to share their stories in a range of ways, including film, audio, or poetry, where they could share their experiences, good, bad, or in the middle, about accessing health services. And I think that has been a very powerful, impactful project. I've seen many of those stories myself, and they definitely stick in the minds and hopefully lead to improved services. The next slide, please. The last principle of the right way approach is, as I mentioned before, it is accountability, and it's one that is unfortunately often forgotten. It can be it's the last one, but it's a really important step, because very often service providers get very busy and carried away with the other steps, and actually doing the groundwork, the significant work that's required to embed and support children and young people's participation. But it's this last point about how we then feed back to children and young people, how we enable them to understand what progress has been made, or where progress is yet to be made or hasn't been made sufficiently, and is there sufficient other mechanisms in place to enable children to really challenge and scrutinise and hold us as service providers to account. So good examples of this would be using, you said we did feedback loops, but also I'm aware of Public Health Wales publishing an annual quality statement where they show their progress in relation to their work with young people and young people's health, and a couple of those covers are the images there. But for yourselves, you might consider yourselves publishing an annual update on what work you have done as an organisation to progress a children's rights approach. Last slide, please. I say last slide, I think, yeah, this is the last but one slide. So this is really, I've finished now going through the children's rights approach and the 5 principles that we would really encourage you to consider embedding within your organisations. And there are lots of resources available to support you with that. But this call, a Wales for All Children, is a call that I am making to governments, but also other public bodies. And it's a call really it's a call to action, and it's a call to really help to prioritise and make more visible and more central all of our existing commitments, legislation, and the range of excellent work that's going on already across Wales to support and progress children's rights. But I feel that we need a bit of a strapline, a bit of a campaign message which can pull all of that together. I've been pleased to see Welsh Government be supportive and welcoming of this, and the quote on the slide is one that Welsh Government has recently used to promote this message. So they have said, they have reiterated about children's rights being at the heart of everything they do. They have reiterated their long history of supporting and upholding children's rights, and they've emphasised that they will continue to put children and young people at the front and centre of the decisions that they make. I think, this is a statement, this is a vision statement that has been made by Welsh Government, but I would really love and invite all of you to consider using a similar using this strapline, but putting the detail of what that means for you as an organisation underneath that heading, so that it can be an easy reminder and a bit of shorthand to refer to the whole, the extent of work that we've been going through in the last hour in this session. But really just to remind everyone about the importance of recognising, respecting, promoting and actually implementing a children's rights approach. So I would love to see all of you go away with, that in your minds. And yeah, there is one more slide actually, which is my final call to action to you in terms of the specific actions that you can take or consider taking following today's session. You all work in the most important roles, really. You are actually day-to-day working with children and young people. So if there's anything that you can do to differently, or hopefully from today, for you to think about what you can do to help children feel more listened to, feel taken seriously, to feel safe, or to help them to get information in a way that they can understand, or to make a complaint. All of those things are very practical, but you would actually be helping children and young people to access their rights. So I would love to for you to be able to think about that and take that away as an action from today. I know that there isn't much time left, and I would love to be able to hear a few comments or questions from you. So I will stop there and just say a huge thank you again to the organisers and to all of you. So diolch yn fawr.
Oh, so fantastic. Thank you. I was absolutely just wrapped by listening to it all. That was just so much food for thought. I have got a couple of questions which have been sent through to me, but first of all, just a couple of comments. I mean, we've pinched with pride your strapline, and we've now decided to have that will be on everything which comes out from the Child Health Network, because I think a Wales for Every Child is just the perfect way of thinking about it. But also we've endeavoured that we've made a commitment that we will always have young people on all interview panels now for any jobs that we're appointing to, which are going to be patient facing. So we're trying to start as we mean to go on. One thing I was going to ask you, Rocio and Rhian, is while you were talking through the last thing, I was almost thinking like a checklist or a brief summary of what would be helpful for the NHS, almost like a one-page, whether that's something that you would consider developing with us as the Child Health Network for, like a children's rights approach to the NHS in Wales, just like a few points, really adapting the 5 that you said, and whether that might be something to make it easy for people to take into their practice. So just something to sort of float out there as an idea. The team will be saying new ideas from Claire as usual. So over to you. What do you think?
I think that's an absolutely brilliant suggestion. Yeah, we already have specific guides for the right way to education, the right way to social care. So it would make perfect sense to me. So I would absolutely love to subject to Rhian's and her team's availability because they're very busy, but I would love to personally.
That would be amazing if you both had capacity.
That sounds fantastic, Claire. I think it's a brilliant starting point to kind of really push this piece of work forward. We've just done work with Rocio on a children's rights approach to child poverty, which of course crosses and interfaces with issues on child health. But I think there needs to be a specific one on child health. So yeah, we really welcome working with you on that.
That'd be fantastic. And then I've got a couple of questions, but I think they're quite difficult actually. So I don't know which of you. I'll let you choose who answers which. But who reports on health's progress against children's rights, and how do you hold us to account, Rocio?
That is a hard question. I have been wondering this myself in terms of where is the accountability, where is the reporting, and I have really welcomed the establishment of this network actually to enable those that pooling of information and discussions, because to me it seemed to be quite spread across the different health boards and not centralized. I do have regular meetings with health board leaders, the leadership, and also with the Cabinet Secretary for Health and Social Care, so that they are kind of the mechanisms that I have to challenge on strategic issues, in terms of individual cases. If there were any children's rights breaches that came to our attention through our advice service, we would follow that up through, as relevant through those relevant services, whether it was the local health board or the particular service providers. So that's where our kind of escalation mechanism would be.
That's brilliant.
Yeah.
Sorry, Rhian. Yeah.
No, I don't have anything to add because I think that's very much incumbent on Rocio as well.
Yes, no, that's brilliant. And just one question in the it just says question from Claire Woodcock from Public Health Wales. Do you have any guidance or insights to share with the NHS staff? Oh, it's disappeared now because it's moved up. Here we are. On GILIC competence and rights to access health services without parental consent. And if you don't, this is something that we can incorporate into the information when we consider it as a lot. But I just wondered if either of you had anything about that.
Claire, yeah, I think this is an issue that comes towards us quite a lot in terms of there is a lack of clarity and understanding around consent often in terms of the context of health services. And I think it'd be very timely actually to do some documentation and guidance in relation to this. I think that would be very helpful. So I'd be very willing to work on this as well. And if Rocio is interested, I think I know that HEIW are very interested in this as well in terms of education around this particular issue. But I think it's timely now in terms of kind of bringing it up to the context and understanding with the UNCRC as well. Thank you.
Yeah, that would be fantastic. I think we're going to have a lot of work to do over the next few years, aren't we? But no, that's fantastic. I'm really sorry, we've only got a couple more minutes, so we're actually going to I'm just going to actually ask Rosie to move the slides on, because what I'd ask everyone to do is it's really important for all of us who and particularly the presenters today to get feedback on what's happened, how you felt today has gone, but also it's really important for us as a Child Health Network that we're meeting the needs of the NHS in Wales. So actually, if there are things that you want us, people that you want us to source as speakers, other events that you want us to do, then please put things into the Mentimeter now again. So the first one is, what child health subjects would you like to be covered for future webinar events? We will be continue to run the series, which will be what everyone in the NHS can do about ... So that's, but also then we can do specific events as well. So I'll just let you all just pop a few things in about the things we had before were looked after children, obesity. We've done one on oral health and things. So transition, yeah, absolutely. We're going to be doing a large project with our new transition lead starting soon. So that will definitely be a future webinar as well. So I'll just let you all do that. We've only got three feedback slides, but it's just really helpful for us to get a benchmark of whether we're actually meeting all of your needs, or not all of your needs, but meeting your needs. So transgender, no, absolutely, that's really important as well. Okay. So just moving on to the next slide, if that's okay. What support would your team need to embed a children's rights? It's not a children's rights approach. It's to embed children's rights in your day-to-day work. So feel free to pop that in the Teams chat. It might be too small to put onto Mentimeter. So please let us know anything that you think any of us from today can help to support you in embedding this children's rights into your day-to-day work. Then please let us know. And then finally, on a scale of 1 to 10, did the webinar meet your needs today? More people. But also, again, please reach out to the and that wasn't finally. Rosie's just quite made me aware that there's one more slide. What will you take away from this webinar today? What we will do as a network is we will get all of the documents which have been shared by Rocio's team and Rhian today and we'll send it all out to you in one sort of package. And also, if you've got any questions, anything you need, then feel free to reach out to us or either of the or us. And if you want to speak to the speakers or hear from the speakers, then we can make that connection. But I just we want to know from you what we can do to support you all. So fantastic, some really great things here. Empowering, Every Child Matters, legislation, child's voice. Child's voice has got to be, it's just got to be front and centre of everything that we're doing. Finding out what's happening in the health board. I think that's something which all of us need to go back and do, isn't it? Really, to ask those challenging questions, call to action, practical suggestions. This is absolutely fantastic. Lots and lots of things coming back here, which is really helpful. But again, as well, you can contact our team at all. And if there's any questions, anything you need, then we're here for that. And as we've gone over by 1 minute, I'm afraid I'm going to have to close this down now and just say thank you both so much. It's been absolutely invaluable. I'm so delighted that you would give up your time to come and do this. And it'd be great if we could try and take this work forward throughout the NHS in Wales. But thank you again, both of you. It's been invaluable. So thank you, everybody. So I think the team and Rocio and Rhian will stay on and everybody else can now leave. Thank you.